Welcome to Not Your Basic Brunettes, where we, Devin and Katie, dive into all things girly and beyond. From sharing TMI moments to navigating life's chaos with humor and vulnerability, we're here to create a safe space for moms, single ladies, entrepreneurs, and corporate girlies alike. Grab a drink, get comfy, and join us as we laugh, cry, and connect through all of life's moments. Now, here are your hosts, Devin and Katie.
Well, welcome back to Not Your Basic Brunettes.
Yeah.
We are Whoa, what happened? She goes, from me. Is it me? Is it you? Is it me? Hello?
We're good?
Okay.
It's like a cat purring in here.
We're just having spirits fly through this room. It's fine.
Yeah.
Hello, friend. You're not welcome here. Goodbye. Anyway, we are going to jump into women's healthcare services.
Yeah.
Kind of jump into that and men services versus women's services.
Yeah.
Don't forget to follow us on Spotify, YouTube, Instagram, TikTok. We'd love to hear your comments and feedback. Okay, let's dive into it. Now, first off, let's start with the statement that men get better healthcare services
Yeah.
than women do.
They're the only ones that are being studied on.
Correct. Correct. Like, for example, men, when you get a vasectomy, I have a friend who works in urology.
Yeah.
You get numbed with lidocaine. You get Xanax, Vicodin, and it's a
You go night-night real hard.
real quick procedure. It's in and out, and you get to go home same day.
Yeah.
With a pack of peas.
Yeah. Well, they also give you, instead of us going home with Tylenol after birthing a human out of our vagina, they send them home with heavy-duty shit.
Yeah, exactly.
And like, it probably hurts worse to get kicked in the balls than it does to have a vasectomy.
To have a vasectomy. Yeah. And they're like, it's 30 seconds.
And it's like on one part you're like, yeah, because women are strong and badass and have like a really high pain tolerance.
Yeah.
But it's like the chicken or the egg. Like, did we have to adapt to that, or are we just like naturally
just this way?
Yeah.
I think honestly we've had to adapt to it because of so many things that we have to go through and been through.
Yeah.
That again they were just like, oh well, you can take it, and you're like, well, but I don't want to. But I don't want to. Like, for another example, so men with the vasectomies, right, get all of these medications and all this to make them comfortable. Okay.
Yeah.
Here's a woman going in for colposcopy. Let's take a hole punch kind of scraper that literally goes in towards your cervix. They take a chunk out of your cervix.
Yeah.
You get no numbing medication, no Valium, no Xanax, no Vicodin. They tell you to take ibuprofen or Tylenol beforehand. And then they put this curdling stuff that clots the bleeding from your cervix into your vagina. And you are literally shitting out coffee grounds for a week. It's just coming out. They're like, you're going to wear a pad after this procedure. And it literally looks like coffee grounds because it's mixed with blood.
Yeah.
And it's dry, like dried out. So it's brown. It looks like coffee grounds. Yeah. And they're like, you're going to be doing this for like a week. Here's a pad. Take ibuprofen and go home.
It's like a dude had his weird poop and they're like, oh my God, I need to see the doctor. And we're just like random discharge. You're like, I don't know.
Don't know. Here's a swab. Test it for yeast or gonorrhea or chlamydia. Great.
It's like on a color scale of what it comes out with. Like, itching or burning. And it's like, why do I need to get to that point where
is it that severe that I should
discomfort? You go there and you're like, oh, well, then we could test for this, or like, have you had your period, or are you pregnant?
Yeah.
No, bitch. I'm not always pregnant. That's not the answer for everything.
That is the answer for everything. Like, let's swab this. Let's do that. Let's poke and prod you. Yeah. Boy, men can literally just pee in a cup for an STD class.
Oh, yeah.
Or have a blood test.
Yeah.
If it's real severe. But how come we can't just do that?
Yeah. And then
I want to do that.
Depends on like our hormones too, because then it's like if you're on your period, then you really get like zero sympathy because you just throw it into the bucket of like, oh, it's your time of the month. Shit just goes crazy. Like, that's all month long.
That's all month long. It doesn't matter if this is 1 week.
Yeah.
Okay, last week I was raging bitch. I don't know what to tell you.
Yeah, like and it's like you don't have control over that as much as dudes want us to believe that we have control over these things. And it's like, okay, well, what is the thing that's like when you're
when we're pissed off or whatever or more emotional, it's because our testosterone is higher.
Yeah.
Have you seen all that stuff? It's like,
Yeah.
oh, we're acting like a dude.
I feel like, dude, funny. That sounds interesting. We should talk about that.
Yeah, it's like, wait a minute, we have more testosterone in our bodies, so we're more angry and emotional and irrational. It's like, oh,
That's why.
explain that one.
Yeah.
But yeah, we get blamed with hormones for that. It's
Yeah.
like, yeah,
But for men, it's a man thing.
yeah,
It's a man thing.
testosterone.
It's
Except for like so
testosterone.
many men are lacking in testosterone now, and like, well, and women too, just
Yeah.
because of the food and all the crap that you put,
For sure.
whatever.
Yeah, I used to work at a hormone clinic. It was very prevalent. I used to work at Her Care in Texas,
Mhm.
and which was like the sister company of Low T, and Low T was like next door. So I would
Yeah.
like go back and forth between the clinics. It's very prevalent. It's actually very more prevalent than people realize that people
Yeah.
have low testosterone for female and men.
Mhm.
And it's very common for men to have low testosterone in your 20s and 30s.
Yeah.
Way more common than you think. Doesn't mean you're less of a man. It happens.
Just get your shit checked out.
Just get your shit checked out, get your shots or whatever.
Mhm.
Same with women.
Mhm.
When we're going through, hormonal changes and things like that, where our testosterone, our estrogen, progesterone, all that stuff is everywhere.
Yeah.
So seeing these hormone clinics, wonderful job. All these providers are
And it
great.
doesn't mean if you have low testosterone, doesn't mean that you're like A, sterile, or B, like
Right.
you can't have children. Like
You can
can't,
still have
your
children.
sperm's fine.
Your sperm has nothing to do with it.
Like, relax. Like you got one thing that comes out of you.
Exactly. It's gonna be fine.
We have lots of stuff that goes in and out.
Unfortunately, women not the same.
You don't know what's coming in or what's going out.
What's going out? Dear Lord.
Well, it's like men's system resets every 24 hours.
Yeah.
So you get a whole new set of hormones every 24 hours.
Yes.
Your testosterone was higher in the morning
Yes.
and lower at night.
That's
but
why we always have testosterone tests. They're always before 10 a.m.
Yeah, but women's it flips.
Yes.
So we have higher testosterone in the evening and lower in the morning. That's also why like your sex schedules never
Never align. It's awful.
They'll touch me with that thing, and then
Like-
they're like, "We can't." I'm like,
But I'm
I'm
ready to
ready."
go. Yeah. Yeah. It's the worst. It's the worst.
It's the most evil trick the universe is like.
Yeah. It literally was like, you're never going to meet the moon and the sun together.
Yeah,
It's not happening.
unless you work from home together. You
Yeah.
just time it right.
Right.
The switch happens
The
right in the
switch
middle of the day.
They literally, I think that's how we got pregnant with our first.
Yeah. Lunch break. Yeah.
Yeah. Sure.
Sure. Keep me in the right spot and feed me afterwards. Well, yeah, then women's is what, 28 to 40-day hormone change?
Yes. Yeah.
So,
Yeah. And then again, your uterus can also hold on to, as we
Yeah.
talked about, like with doing the, what is it, the bunch test?
Dutch.
Test. Thank you. Sorry. Right on. Your body can hold more estrogen at certain times, causing more issues to happen. So
Estrogen's such a bitch,
it
man.
is. It is.
Like, why can't we just have more progesterone in our body,
Yeah.
except that we'd all be super bloated all
True,
the time?
true.
Because it's our feel-good
but we
calm,
would be able to
but we're
sleep more.
chunky.
Yeah, we would be able to sleep more.
I know. I take progesterone every night. Yeah. Yeah, because the estrogen, makes you be able to work out better. You
Yes.
know, you have the more energy. But it's like that time when they're flip-flopping.
Yeah,
It's where it, like, right before your period and right after. That's where it gets crazy
Yeah.
because it's either going up or going down, and it's a fucking roller coaster ride.
Yeah.
Every time.
absolutely. I want to get into also, so like with medical services, same thing as you're saying that men, obviously, we're doing more clinical trials on men
Yeah.
and not women. I feel it's the same way with medical equipment.
Okay.
So, for example, women get mammograms.
Mm-hmm.
You smash a breast between two metal plates to get this image of this breast.
Yeah.
Okay. We would never do this on a man to just crush
smash
his
his dick.
testicles
Yeah.
or dick to make an image. I'm sorry. But like, let's get real. How come no one has come out with a better way
Well, now
to do a mammogram?
they're doing it differently. I think women are going in for like CAT scans or MRIs because they're finding out that mammogram machine is actually causing more breast cancer
Dear
than
Lord.
catching it.
That's what I'm saying. Like, why don't we do the study beforehand? So smashing women's breasts all day long.
Dude's like, let's see how flat we can get it.
Yeah, look, it's like a putty. Yeah.
Oh,
This is not Play-Doh. Guys,
Yeah.
this shit hurts.
yeah. No, I've never. Have you had one?
No, my mom has though.
Yeah.
And she's got big boobs, unfortunately.
Yeah,
so
that would
they're trying to,
hurt.
and they're trying to like smush as fast as you
Ugh.
can get it. Like, that's
No.
uncomfortable.
No.
Nobody wants that.
I hurt when there's like too tight of a bra on.
Yeah,
Sports bra. Jesus.
for real. So again, why we haven't come up with a better way, but even so, with better way, why didn't we figure out this before? Because nobody would have been like, "Hey, dude, let me just smash your testicles in like a machine to get an image
They
of
don't
it."
even want to undress.
Exactly. We are naked
all the time.
all the time, guys. You're uncomfortable with getting a prostate exam like once a year, if that. We're naked all the time. You need a breast
Yeah.
exam? Undress. You need a pap smear? Undress.
Well, it starts at an early age too. I remember being probably like middle school when you have your physical exam, you're
Yeah.
in this gown, and of course your parents are hopefully in there with you, but like
Yes.
you're literally touched from top to bottom. Like
Yeah.
they squeeze your boobs because they're checking for like growth or
Growths
anything
and
like
bumps.
that.
Yeah.
Like that. Like you're literally fondled at that young of an age from a stranger, technically quote unquote doing their job. But like,
Yeah.
I mean, did they do that with I didn't go to the doctor with my brother, so I don't know what's like, do they do that with
Yeah.
dudes too?
With Kai, no.
Yeah.
Like to check their spine. They like
Yeah.
they lift his shirt in the back and then have him bend over, touch his toes, and then like run their finger along the spine to make
Yeah.
sure the spine is like correct and
Well, they're not like
okay.
yeah, with Campbell, it's like they're not I mean, their balls haven't dropped yet 'cause they're
Yeah.
little, but, like, they'll kinda, like, check their butthole and see if it's okay, but, like,
Yeah.
I'm obviously there, and, like, they just kinda glance over, they're not, like, prying him. But, like, at what age, like, when the dude's balls do drop,
Mhm.
do they just go like, they don't go in and just, like, caress their junk?
I don't know. I don't even know. I don't know. I don't know what age that like
Right.
really starts because like obviously like the doctor like checks them. Like
Yeah.
Kai just had his physical and they just had him like pop
Yeah.
shorts down really quick. Just take a quick peek and then
Yeah.
pull his pants back up.
Yeah.
But I have no idea when they do that whole
Like, coffin thing?
cough and turn.
Yeah.
Don't know if that happens.
I don't know, I need to ask these questions, I
Exactly.
guess.
But even still is way more comfortable than having a gynecological exam
Well, yeah,
where it's
because you
like
start that early too. Second you get your period, you're like, "Alright, let's go up there."
not even anymore now. So we stopped doing that.
Oh.
We stopped doing pap smears before the age of 21.
Oh, wow, okay.
Yeah, that's a whole game changer because so many kids and high school age were being diagnosed with HPV
Mhm.
that it was like kind of like widespread, like
Yeah.
way too prevalent. And they were like, there's got to be something risk. Well, the problem is that at this age group, HPV runs rampant,
Yeah.
but most of the time it resolves itself by the time they're
Right.
like 18.
Yeah.
So they were like, we have to stop doing these pap smears before
Mm. Mhm.
certain age group, or else we're just going to constantly keep getting wild like HPV like
Yeah.
everywhere.
Yeah.
Another reason too, they came out with the HPV shot,
Yeah.
which was to keep that prevalent
You had to get that before
down.
college, that hurt.
Yeah.
Remember that.
So you had to keep that prevalent before going down. So they did change that. So now it's HPV shots at the age of 12, which parents,
Too young.
I understand it's at 12. I understand.
Yeah.
But the whole point of doing it that young is because then at that age, because I had to explain to parents all the time,
Okay.
I don't mean right this second they're going to be sexually active.
Yeah.
Eventually, at some point in their life, they will be sexually active.
Mhm.
And you'd rather have them vaccinated than not have them vaccinated
Yeah.
and dealing with it. Because the problem is not just getting HPV, there's two types. There's cancerous type and then there's warts type.
Ugh, yeah.
And the warts ones are very uncomfortable. You have
Yeah.
to get them frozen off and like all the kind of stuff like constantly. They don't
Yeah.
just go away. You have to like keep doing it as the process goes until the HPV either resolves itself or you get the cancerous type, which can either resolve itself
Mhm.
or eventually it could turn into something else. Cervical cancer.
Yeah.
And it's funny because too, Dr. Goki, when I worked with her for a long time, love her, would also explain to parents HPV also prevents from esophageal cancer from oral sex.
Yeah.
So people don't realize that because of these HPV cells that you can get esophageal cancer from oral sex with this.
Yeah, and then also, like, dudes can carry it without, like, having any sort of symptoms.
Correct.
And, like, girls, I guess, unless you got, like, the warts one, like, you
Yeah.
can't really know either, but the only reason you find out is because you were having those pap smears.
Correct.
And dudes don't have pap smears.
They don't have pap smears. They don't have
So
a
they
way
don't
to
know,
test
yeah.
them for it. So we did change that, which was then also made those HPV numbers go way down
I'm sure,
compared
yeah.
to before. Then the HPV shot was helping for the preventatives, which I'm super happy they came out with those because unfortunately I lost my virginity, in
Mhm.
high school, and the dude that I was with gave me HPV,
Yeah.
and of course, then from then on, I had to like tell people that like I had,
Yeah.
if I was dating anybody and they wanted
Well, that happened
to
to
get
me, but it
serious.
resolved itself.
Correct, but
Yeah.
didn't know that at the time.
Yeah.
So then telling people, then they're like, oh my gosh, you're a whore,
Yeah.
blah, blah, blah.
It's like
And it's
actually
like,
majority of people have
the
it.
majority of people have it and most people have it and don't even know about
Yeah.
it. So, and more than likely you probably have it or you
Yeah.
probably have, like,
Well, like it didn't. Who says it originated from you?
correct.
Because you don't have the symptoms. Yeah.
Exactly. So, that I feel like that education has definitely gone way further than we expected
hmm
with that. But it's still very hard to get parents to vaccinate their kids before they become sexually active, which
Yeah.
is super frustrating. Because again, they may not have sex, but they could have oral sex. They could be doing other things,
I
you know,
know.
like
I'm like thinking back to when I'm 12. I'm like, I was just so far out of the realm.
no, totally
Like,
understand. And we're not
so-
saying it's like at
I know,
12 years
I
old.
know.
You know,
But it's just like
more
that's in your
just
mindset of like, oh my god, that's
yeah,
so young, and then it's like,
yeah.
no, that shit happens all
It
the
does
time.
though, but like
Yeah,
in like I remember when I was in middle school, I had kids getting like, you know,
yeah,
curious and doing things and you'd hear about things. So it's like
yeah,
it's not far off that people
yeah,
think because again, they're starting to go through those hormonal changes and you know, having boners and erections
yeah,
and you know, feeling things in the Yaya Sister Club. Okay, like that's it just happens. And it's
yeah,
not saying I'm like, and your kid's gonna be sexually active. I'm not saying that. I'm saying let's protect them for the future.
yeah.
Because eventually, at some point, they'll
They're
become
gonna.
sexually active.
I was just watching part of this podcast from the Diary CEO with this expert on there that's saying that like men under 30 are like having less sex than ever. And she's
Yeah.
like, the majority of people that come into my office for like erectile dysfunction are dudes in like their 20s and
Wow.
30s.
That's surprising.
Yeah. Because of online shit. And there's like,
Yeah.
because you get so like used to like
Wrapped up.
yourself pleasure and that
Yeah.
like you when you're with a partner like she was like we're missing out on partner connection
Yeah.
even if it's like
that's understandable.
not like a long-term thing but so many people are like abstaining from dating, they're not dating, they're not having, there's
Mhm.
like she's like you travel in groups now,
Yeah.
you know, there's
Yeah.
not, they're missing that one-on-one connection that like you're generally built for, so it's
Yeah.
like all the online presence and even starting way younger nowadays because it's so everywhere that your body just gets so used to it
Yeah.
just being you and that stimuli, and then when you're with a person and you're
Yeah.
not building those connections either emotionally or
Yeah.
physically, that it's like it's kind of scary.
I mean, it actually makes a lot of sense. Like I
Yeah.
told you the other day, during COVID when I gave that lady a flu shot,
Yeah.
literally, poor lady was at home alone for 8 months during COVID. She's probably in her 80s.
Yeah.
We did a drive-up flu shot clinic to help vaccinate the elderly population in Loveland area, and I literally was just talking to her through her window. I touched her arm. She cried
Yeah.
because that was the first person who's touched her in 8 months.
Yeah.
And I just touched her arm. I didn't do anything.
Yeah.
So it's not surprising that
Yeah.
this would happen, especially after having COVID and people just kind of hermiting to themselves.
Well, it's also like hermiting, but also just like the dating scene is like, especially with online and like
Yeah,
Instagram and stuff like that. It's
for
like the
sure.
idealization of like there's so many options out there,
Yeah,
but yet like you say there's so many options, but you're not getting any
not
of those.
getting any of it.
The
Yeah,
option is I
yeah,
was like, what makes you special thinking that you're gonna get this fake Instagram model of a person,
right,
and it's like maybe you don't even like them, maybe you don't even like
right.
their personality.
Well,
Like,
even so, like think about that virtual reality that's coming out now too.
but like for me, it's like yeah, I can understand how that like feels good and
Mhm.
like is a fantasy, but like at some point, like
Yeah, it's not
it's
the
like
same
human to
thing.
human contact,
Yeah,
like the
it's not
skin
the
to skin
same
contact that you
thing.
get.
Yeah,
I mean, that's why they put babies on you. That
it,
oxytocin, that
correct.
you know, like there's a physical bond. Otherwise, we wouldn't have this as humans.
Yeah,
Like we
yeah,
wouldn't biologically be wired to procreate in that sort of way if in the way that we do it if that
yeah,
didn't produce these sort of chemicals that are good and healthy for you, because
yeah.
it's like if you're in a healthy relationship your health vastly improves, and if you're
Absolutely.
not it
Oh,
goes
it
downhill.
declines
Yeah,
immediately.
and
Yes.
like it's very not simple, but like
Yeah.
it means a lot to have like a connection with somebody
Correct.
in a physical form,
Yeah.
you know.
I
Let's-
know. I totally agree. Because I'm a people person. So
yeah,
like I like to be with people, physically touch people,
yeah,
you know, just in general. Like I'm a hugger. Like, you know,
yeah,
like that's me.
yeah.
You know, I know you're not, but
I'll accept your hugs.
I think because I get it. It's like I'm the golden retriever. She's my black cat, which is fine.
Just make you little biscuits.
Yeah.
Don't fucking touch me.
Yeah, exactly.
You did what?
Making butterbug biscuits, but fuck off. Fuck off.
Scratch my butt for a second and I'm out. Yeah. No, I mean, it certain people, yeah, for me, but like strangers, like I don't I don't know
Yeah,
you.
I get that.
I hate when, and I feel like it's more of a woman thing to go up and like touch another woman
Oh yeah.
uninvited. It's like I feel like for what I'm trying to say, like when a man touches you uninvited, it's like this big thing.
Yeah.
But we don't talk about like, especially the older generation women that just come
Oh
up to
my God,
you.
yes.
I would remember I was sitting at work one time when I was like 24, 25, and one of this lady just came up and started rubbing my shoulders. I was like, what the fuck
What are you?
doing? This is a workplace. Like,
Yes.
like,
I feel
no.
that. I
Yeah.
would get random, especially when I was pregnant, like random women would just
Yeah.
try and come touch me. I'm like, whoa.
Or they come up and like rub your hair. It's like, what the
Like,
hell?
who the hell are you? I don't even know you.
You're not my mom. Get out of
She
here.
doesn't even go here.
She doesn't even go here.
Is that true? You don't go here? No.
Who is this lady touching me?
That's literally me, though. I
Yeah.
was like that for pregnancy. I was like, whoa. Like,
Yeah.
don't just randomly come up and touch the belly. Like, that's weird. Like,
Yeah.
guys, at this point, it's 2025.
No touchy.
Please don't go up to women and just
No
randomly
touchy.
touch their belly or their hair.
Yeah, you want to piss off a pregnant woman?
Yeah, real good.
luck.
Real good.
Good luck.
You're done. We're unleashed fury.
All
You're
right, so
done.
in non-medical places, I know we kind of made this medical-ish, but like speaking of like proking and prodding women, like what are some other places that we have to be like naked in a non-medical sense?
Tanning salons.
Yeah.
Massage parlors.
Yep. It's always those
Uh,
like, I want to be stereotypical, but like Asian parlors that
Yeah.
like pull your sheets down and I'm like, why is it even covering my ass? Because I feel like you're literally just like rubbing my ass cheeks and you're like, I feel weird about this, but it feels kind
But
of
at
nice.
the same
but
time,
like,
yeah. But it's also weird.
yeah.
Oh
like,
my God, that happened to us on our honeymoon.
Oh God, please stop.
So I booked us so overseas massage is very
Yeah.
different.
Yeah.
So we went to Santorini for our honeymoon and I booked us a couples massage with a
Mhm.
sunset view
Oh
at
yeah.
the end.
I did one
right?
of those at Thailand. You're just
Yeah.
like fucking spread out.
Oh my God. I felt so bad because so like they like told us to like shower, like we
Yeah.
have this like beautiful bath-in area for you guys to like shower and rinse
Mhm.
off beforehand. And then you put on these like paper thongs.
Paper thongs.
So they
You
were
just
like
rip
paper
it.
disposable, like the medical disposable like thongs you like
Yeah.
put on. And Omar was like, "Do I have to?" So I was like, "I guess you do, because that's all they give you the option for." So I'm laughing. So of course he's like, "How's it on?" He's like, "Is that gonna sponsor my ass?" And I was like, "No," because I'm thinking American massage. They don't usually come up like pull
Yeah.
your sheet down and massage your ass.
Yeah.
Oh no, was I wrong? Because like we're doing the massage and then all of a sudden like both of us are like it's like in sync, like
Yeah.
with the massage and like of course like the ladies there only massage ladies and men only massage men. So
Oh.
that there's no
Adds another layer to that.
it's another layer. Let's add that because I didn't care.
Yeah.
But then they were like it's kind of customary that we especially if
Yeah.
you're like married and like
In
and I
America,
was-
it's so different. It's like
Yeah.
a dude's like, don't touch me with another
yeah,
dude.
exactly.
Yeah.
So and that's what I thought. So I was just kind of like, whatever. I don't
Yeah.
care. And usually I don't mind if it's a man masseuse too, either, because usually they're a little bit rougher. Like
I had
get
one
into
that
those
like,
knots.
wouldn't shut up when he was doing it to me. He was like asking me like all these questions about work and talking about his girlfriend. I'm like, dude, this is not enjoyable.
It's not enjoyable.
I don't want to
Shut
be your
up.
friend and
Yeah.
hang out with you after you've like seen me almost
See me
naked.
naked. Yeah. So anyway, we were getting massage, and then of course, like right at the same time, they're like pulling the sheet down. You can
Yeah.
just feel it going over our butt, and all I can think was, "Oh my God, my poor husband right now."
And
And we're just
favorite
getting
thong.
full body
Oh yeah.
massage,
Just rip it off, I guess.
thong, the whole bang, and then just. I mean, eventually
Was it
it was
good,
fine.
Omar?
Eventually it was fine. We both fell asleep.
Yeah.
Like during our massages after that whole butt.
Yeah.
But oh my God, I was like dying. I was like, well, we're never doing this again.
And you can't like lift your head up to like look at
No,
him. Like
all I could think was just like the left, the left, the left.
you can feel the body heat coming off of him.
Feel
just
and
like,
then feel the sheet just going. You're like, oh God, I was dead.
Oh. Yeah, that's that's funny. Yeah, when I was in Thailand, we have one of those like it's a Thai massage, so they do a lot more stretching and
Yeah.
like massage too. But you're in this little hut on the beach, and
Yeah.
I think I was in a probably topless in a bathing suit bottoms or something like that.
Yeah.
And it's just like she just has your legs just completely spread apart, and you're like, this feels amazing because I haven't had
Yeah.
this deep of a stretch in a long time, and I'm
Yeah.
like, I'm never gonna see you again. So like, okay,
let's do it. I'm down.
That's great. See
Yeah.
you later.
Girl, I felt that. One time we also went to one of those like Vietnamese like spa massage places in California, and they like step on you.
Oh yeah, I've never had one of those.
It's okay. It's not bad.
Yeah.
But it's like the kind of thing. Homer's done it before. They were just like, he's just like,
WWE.
yeah.
Take down with a chair.
I'm like, you're getting the rough stuff.
I'm sorry, Omar. You
Sorry,
have to
Omar.
go to massages with your wife and get
Yeah,
beaten up. And
we're having a great time
violated.
together. It's called bonding.
Trauma bonding.
Trauma
That
bonding in
way.
our marriage. It's great.
Yeah, I mean, when you get a spray tan, you're like 2 feet
Completely
away from
naked.
this person.
Yeah.
You're like, hey, spread. You're just. I mean, you could be
Completely
as
naked.
naked as you want,
Yeah.
depending on what tan lines. I usually keep some sort of form of underwear on.
Yeah,
so I'm
it's
like, I don't
usually
want to get some sort of
thin,
like
yeah.
spray up there and get
Yeah,
an
same.
infection. Or
I feel
something.
that.
I don't
That's
know.
me. I'm so sensitive down there.
Yeah.
I'm like, don't get that sugary spray
Yeah.
like anywhere near
Yeah.
that area.
But then it's also like, hey, lift your boobs up. You're like, okay. And then it's
Yeah.
like you bend over and like lift your butt cheeks apart. Okay.
Like, all right.
You do this all day, so like they
Yeah.
don't care
They don't
after
care.
a while, but like
I'm the same way though, because I worked medical for so ever. Everybody like, be showing me like, girl, once you've seen it, you've seen it all. I
Yeah.
don't give a shit.
yeah, I feel like I'd get to that point eventually unless
Yeah.
someone had something funky or I don't know.
Yeah.
That's everybody.
You never get used to someone trying to flash you though. That's one. That's one.
Yeah.
My poor coworker, they were always kids flashed like by dudes.
Just
Like
like
men, okay, guys, you have a problem. Men have a problem. And I'm talking about all dudes. Y'all need to get over this, okay? When there's something wrong with their penis, they
Wanna
want to
show
like
you
show everybody.
yeah.
What's wrong with my penis? Bro, I'm not the doctor. You don't want to whip that thing out and like show the medical assistant, okay? No one needs to see it, okay? The doctor will come in and examine you.
Yeah. I'm just getting your blood pressure, bro.
Yeah, just here to literally get your blood pressure. You don't have to flash your thing around and figure out what's wrong. Because eventually, one, I don't know.
Yeah.
Two, I'm going to send you to the doctor anyway.
Yeah.
And three, not necessary.
Yeah.
Keep it away.
Yeah.
You're literally inappropriately flashing a staff member, even though they're medical. It's not necessary to flash them.
Yeah.
When they're not going to be the ones diagnosing you.
Yeah.
So just
Even
don't.
if I'm like at the gynecologist, I'm still just like self-conscious of like, oh
Yeah.
you've seen vaginas all day, but you haven't seen mine in
Right.
particular, so it's gotta be different.
Right.
Like,
I feel that.
yeah.
But I'm so like anal about it too, because I'm like, as soon as I like, if I know I'm going to get a gynecological exam, I'm like, I need to shower, and like,
yeah.
like clean myself up, just like in general.
Like, did I miss
being
anything?
courteous. Yeah, I'm being courteous, just making sure everything's like easy for you to do your exam
Yeah.
and just done. But it's always funny because we always like laugh about the joke of like hiding your underwear.
Yeah.
Like when you like do your you like
Fold it up,
fold it up
nice,
and like
yeah.
hide it, and you're like closing. But all you feel like is like have this worst fear of like they're just like going over there like
I want to see
her
your underwear.
underwear.
And you're just like spread. You're like, but you can't see my undies. Okay.
Yeah.
That's embarrassing.
It's
I wore granny
embarrassing. It's
panties
embarrassing.
today.
It's like nobody fucking cares, guys. But everybody does it. Everybody does it. And
Yeah.
they're just like,
Well, I
"Hey,
know. I
has
love
to
all
be
the TikToks that came out about it.
Yeah.
It's like, and they like run in, yeah, and check it.
run in. It's like, oh, these are nasty. You're like,
This explains
yeah.
everything.
You're like, oops,
Sorry.
wrong underwear.
That's
It was laundry day.
all that I had.
Sorry.
That was me recently. I'm like, oh, all the underwear that's gonna be giving me serious granny panty lines, but
Oh well.
all the other stuff's in the wash.
Like, oh well.
Now we're underwear.
Hey.
Oopsies.
Oopsies. Sorry, guys.
Yeah.
That's another thing. Granny panty lines, don't care.
Yeah.
Honestly, don't care. Like, women are wearing underwear. Get
Yeah.
over it.
Yeah. Cover our asses for a reason.
Yeah, literally. Literally. And also at the point, there are days where it's like, I don't want to have a thong going up my asshole.
Yeah.
Yeah.
I mean, I've gotten back into them recently just because like athletic gear, I guess.
Yeah.
But yeah, after babies, I was like, fuck no.
Yeah.
And they're also just like not actually
Comfortable.
cut the right
They're
way.
not. Guys, whoever invents these thongs are like triangles like this. Nobody wants that.
Why even wear underwear
It
at that point?
it just covers the front. It doesn't even come downwards
not
enough
the
far
important
enough
part.
Yeah. for anything to be covered, and then you just literally have just string going right up your vagina and asshole.
Yeah.
There's nothing.
I remember my first thong. My sister bought it for me because I was not allowed to wear them yet. Of course.
Risky.
I think I was in high school too.
Yeah. My
like,
dad did the same. It's
yeah,
fine.
my dad was like had 3 girls and doing laundry. What is this, dental floss?
Yeah. My dad would like throw them away in the
Yeah.
trash if he ever saw them. And I'm like, Dad, I bought them
These
with
are
my own money.
expensive.
Yeah. And he would know. He'd like throw them away. And you have to like do
But
your
your
own
wife
laundry.
was one? Come on.
Yeah, exactly.
Rude.
I don't think my mom was ever the dental floss type though.
Yeah. I didn't make those back then.
Like thongs, but not those thin. You
Yeah.
know, thongs. You know what I'm talking about? Where
Yeah.
it's like,
Yeah, and I don't wear those anymore
yeah.
because they
Her-
just there's no point to
Again,
them.
there's no point. Yeah,
There's
exactly.
no point to them.
It's not covering anything, guys.
No.
Not a damn thing. And really, you might as well just go all natural, al fresco, if you're gonna do that.
Yeah.
Because it doesn't cover anything.
I know some people that just like really enjoy doing that, and I'm just like, I don't know.
I had a patient do that once. It was
Yeah.
hilarious. He came in for
He came in?
he
Okay.
doesn't wear
I can understand like baseball. No, not baseball. There's too sheer for
Too
that
sheer.
sort of
Yeah.
situation. Sweatpants, thicker.
Yeah.
But like dude in jeans?
he was in like cargo shorts.
Ooh. That's a lot of
Free balling
friction.
it. Free balling it. Yeah. And I was like, he came in to like have this like thorn removed from his like leg. He had like had a bike accident.
And then he
Like-
showed you his penis.
No, almost. He almost did, actually, because unfortunately it was in his thigh. So we had to like
Oh.
tape the paper like shorts down that we
Shift
gave
it to
him.
one
I'm dead
side.
serious. This is people. This is people. Dear God. But yeah, he had like a thorn. He like he was like riding a bike. Like, he was kind of like an outdoorsy
Mhm.
kind of dude. He would like rode a bike and like fell into a thorn bush. And one of the thorns, it was pretty long. It was like yay long.
Jeez.
Had like gotten into the leg, but it didn't have it like removed.
Yeah.
And then it eventually like kind of made like its own like dermis over it,
Yeah.
trying to like protect itself. You know, the skin trying to like
Yeah.
get it out, but it's not going anywhere. But it was causing him pain, so they were like, okay, now we're gonna like take it out.
Yeah.
So
Or
we
not,
got
right?
it out. But yeah, but then my doctor I was working for, it was so nice, Dr. Shivetta. He's retired now. But it was hilarious because it's okay. Well, we'll just get that out of there, and we'll just put these on. And he's like, we'll get you all draped out in your underwear and blah 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 blah. And he goes, I'm not wearing any underwear. And he's like, oh, okay, well, and Dr. Shivetta, he's so nice. So just be the nicest man you've ever met. I was like, oh well, I don't want to get blood on your shorts, so. So
Wear
I was
underwear,
like, well,
please.
we have some paper shorts that we can like give you, and he was like, okay, great, well, we'll do that, So we like get them prepped and ready, and then like I
How
said,
do
like
yeah.
taping, like, but then we have to like rip the short and then like tape it one way, because it's like in the. That's like great.
I love how dudes can scratch their balls, but women can't scratch their
Yes. Or they like pull their boxers out of their
Or
ass.
heaven forbid we have an itch and they're like, oh my God, you got some infection down there.
Yes.
It's like, no, dude, I got friction just like you, if not more.
If not more.
Well, there's sweatier down
There's
there.
thunder thighs. There's vaginal. Come on, guys.
You didn't shave.
Yeah. It's the worst. Like itches.
Yeah.
Just itches.
And then, yeah, it's so annoying because, like, even if you, like, scratch your inner thigh, it's like, ooh, you got an itch
You
down
itch
there?
down there? Yeah.
Yeah, I do, actually.
I do.
I have a body. Thank
Yeah.
you.
That's why it's so annoying.
I'm not like,
Stereotypes for that, guys. You gotta
stereotypes,
stop.
yeah.
You gotta stop. Same thing with guys like pull their boxers down or something like that. It's like, but girls get wedgies, okay? Period.
I'm so bad about picking my wedgies in public. I'm like, I need to stop. But it's just like, I don't know.
It's uncomfortable.
Yeah.
I feel it. Because even me, I'll be like, I don't give it.
Well, and then you, like, look at your kids and they're, like, yanking their underwear down. I'm like, I don't blame you.
Yeah, it hurts.
It just, when you sit down in the car, you get up and
Yeah.
women's underwear, like, they're never the right size. They're either too big or too small.
Yeah.
And, like, your ass cheeks are hanging out, one or the other. And
Yeah.
it's like,
Either fully covered or ass cheeks hanging out. It doesn't make sense.
no. And then thin material, just the wind blows, things get stuck places.
Yeah. Kayak is the same way because a poor kid, I don't know why he like, pulls his boxers up like that.
I love when they do that. Campbell does that with his PJs. He's like up to here.
And you're like,
tucked in.
doesn't it hurt up your. Okay.
No.
Okay.
He's like, probably feels good.
Like, all right.
Whatever, dude. Yeah.
Oh, man. So eventually, as we're like coming into more medical and clinical research,
hmm
clinical research is now evolving and starting to include women
Yeah.
into studies for medical equipment, medical services.
Did you know what the crazy part too? I forgot to mention this earlier. Is
Huh.
like running shoes.
Yeah.
they're now having like special, like this woman created running shoes specifically for women because women's running shoes are modeled off of a man's,
Men's. Yeah.
but just smaller.
Makes sense.
Yeah.
I mean, it makes sense. That's what I'm
But
saying.
like our feet are different.
But at the same time, it's like, why does it take us so long to do this? Like, women have been around for a long, long time.
This is the beginning.
This is the beginning of the end. Like, oh, Lord, the beginning of the end and the end of the beginning going
But it
for
seems
us.
like it's almost gone reverse too, because like when you look back in the days, like, hey, well, women wore these dresses and so did men.
Yeah, true that.
You
True
know,
that.
like
Yeah,
look at all the history stuff. They're all these like drapey clothing,
yeah. Men in kilts.
kilts,
Kilts.
sarongs, essentially.
Yeah.
They
Yeah.
were free balling it too.
They were free balling it. Oof, in a kilt.
Yeah.
Oof. You just see the battlefield now.
A lot more ass cheeks that are ever
A lot
shown
of
on
ass
TV.
cheeks going everywhere, guys. Sorry.
So it's like I think it was like swinging different swords. We're gonna get in trouble for this one.
I know, we're in trouble. Explicit material.
You were talking about something serious before I brought up dresses.
This is how we end up getting there, guys. Sorry. And you think we would be on something for these episodes, and we're not. It's purely our brains.
Yeah. Free ball brains.
What was it talking about?
You talk about clinical research.
Clinical research. Back to serious.
So you were saying.
Cheerio. Going back to clinical research. So things are improving for women.
Yay.
Thank God.
We can vote, and
Yay!
now we have medical assistance.
I know. Now, if the Cheeto Puff would stop taking away our rights, that'd be great. But also with clinical research, like we talked about mental health already, but also that we've talked about that mental health clinical trials are now being performed on women, and we're learning a lot more that clinical services are not being offered as much as it is for men. What as a female, what would you like to see improved in certain areas and aspects for yourself?
I mean, just going off of like my personal experiences, it's like just fucking understanding the female body and how it works and how we're not like, not saying that like all men are cookie cutter.
Yeah.
Like women are not cookie cutter in their diagnosis. Like understanding that every person is an individual and like you can't just stick them into like one thing. You know, like if a woman's saying that she doesn't feel good and something doesn't feel right, like listen to her. It's not in her mind. I know a lot more women that are more interconnected with their body than I know some men that, you know, don't even go to the doctors or anything like that. So if we come to you and we get to the point where we're saying, hey, I feel weird, I feel off, these are my symptoms.
Yeah.
Like don't fucking brush that aside and mark it off as like a mental disorder or something like that. 'Cause it's like, that's not where it's stemming from. It's stemming from something else. And we were talking about this before we started. It's like 80% of women get an autoimmune disease.
Yep.
And like a big part of it too is because one, they don't know the body as well. And two, it's like throughout society, you're told to suppress all of this shit.
Yeah.
You know, it doesn't hurt, you know, don't be angry. A lot of it comes from anger. Like you don't be angry, this sort of stuff, like get in line. And that shows you like that has a direct effect on your body and your cells.
Absolutely.
And then your immune system starts attacking each other.
Right.
You know, and it's starting to come out younger and younger in women, especially I feel like late 20s, early 30s.
Yeah. Yeah. I agree. Definitely seeing that as well with like cancer patients too.
Yeah.
A lot of women are brushed off for their symptoms. And what they're feeling and diagnosing, and they like put it as, oh, well, you have fatigue. Oh, well, you have this, blah, blah, blah. And then a year later, oh, you have full blown cancer.
Yeah.
And now we have to do something about it.
Yeah.
And that is super frustrating.
Yeah.
I've had a lot of cancer patients that has happened to, and very young women with breast cancer or a lot of different type of what do you call it? Like kind of like autoimmune cancers, blood disorders.
Yeah. And it's like, especially if you've had kids as a woman, it's like you talk about fatigue. It's like, yeah, you're a mom. Like I got that so much from like mental health professionals. Like, yeah, you're a mom. It's taxing on your body. You're like, yeah, I understand that.
Yeah.
But like, at what point should that not be the status quo and that should not be the norm for women?
For sure.
You know, it's like we're not built to sustain all of this while also raising children at the same time. Like you, at some point, like I'm all for gender equality and that sort of stuff, but there is a
Yeah.
difference biologically between a man and a woman.
Yes,
Like that's why
absolutely.
there's two of them, whether you identify with one or the other. Like there's a difference biologically in how you work and how you function inside your system. So
Yeah.
it's like pay attention to that. You can't just group us all in one bucket and say, "Oh, this is a generalized thing."
Yep.
So it's like, no, yeah, I'm tired because I'm a mom because I don't get sleep, but
Mhm.
also like, what about the aftercare for women?
Absolutely.
Even something as like pelvic floor,
Yeah.
given through insurance for free.
Yeah.
And like, look at
I
all the other
agree.
countries. They have the nutritionist. They have all these sort of things that helps build the body back up
Yeah.
after creating one.
Yeah. No, absolutely. I actually looked into what was it? Korean nannies
Mm,
after birth. They like stay with you for like 2 or 3 months, like after birth, and
yeah,
like literally help you do everything.
that's
Like
amazing.
they cook, they clean, they massage, they give you like do bath, like the whole thing for mom to recoup. It's
Yeah.
not just for baby. Like it's literally they're there. Like I love their culture and what they do for people
Hmm.
after birth.
Yeah.
And I think it's so amazing. And I feel like every country should do that.
Germany's really good about that too, I
Yeah.
think. Yeah.
Yeah. But I'm like, I was actually looking into it and I was like, can
Yeah.
I get a Korean nanny here
Can
in
I have one
America?
now?
Can I have one
My
now?
kids are a little bit older. Can I have a nanny
Because
for
I want one
myself?
now. I still feel like I'm going through postpartum.
Yeah.
Like,
Well, you are though, because
yeah,
it takes what, like
2 years, 2 to 3
minimum 2
years. Yeah.
years, but and then it's like you have consecutive kids, and
Yeah.
so they said I found something that said like like you don't get like your body back, quote
Yeah.
unquote, until like 7 years down the line,
Yeah.
and like by the time that happens, like you're done,
Yep.
you know,
Yep.
because like people, yes, it's important to focus on the baby, but baby's there to eat from mom and have love and
Yep.
snuggles. Like
Yep.
you need to you need to flip the script of
Yep.
like, hey, we need to take care of mom. So I was talking to someone who was like, okay, when you're pregnant, you get all the doors open for you.
Oh, yeah.
Second you pop the baby out, they're like, good luck.
Good luck.
I'm like,
See you
I have
later.
a fucking stroller. Can you open the door?
Yeah.
You know, and then you had another kid, and everybody's even more like, fuck you.
Yeah.
Your kids are an annoyance.
Yeah.
Get your shit together. It's
Yeah.
like,
Our kids should be, yeah, like I said, seen, not heard kind of
yeah,
thing. And it's like, they're kids.
yeah,
They're supposed to be loud and rowdy. That's their kids.
yeah. Yeah, I feel like it's just very backwards. And I understand, like, yeah, pregnancy is a beautiful thing. You're creating a life, but like, it's
It's
not
rough.
born yet.
Yeah.
It's not born yet.
It's not
It's
born yet.
fully protected inside of this womb,
Yes. Yes.
like as it's meant to be. And
Yeah.
mama needs to be protected outside of that. That's a big
Yeah.
one too.
For sure. I get that. Yeah, and I feel like it's so gender role backwards for that because, like, whenever dads do it, they do such a great job,
Oh
and then
my
we're
god.
like,
I literally told him what to do because I wanted to fuck off for a minute.
yes,
Take him to the playground, please.
and I can enjoy 5 minutes of peace.
Well, it's like now that I'm a single mom, I take my kids to the playground whenever they want to go to the playground.
Yeah,
I don't have an option, you know? And I went on Friday one day and I was like, where are all the moms? Like, I was in a
exactly.
sea of like dudes, and I was like, oh, that makes sense because mom's tired by the end of the week.
Yep,
Take
gotta
them out of
take
my
them out of the
house
house.
and
Yep,
go,
yep,
you know? And it's just like, you know, when we were at the zoo the other weekend, it's like,
yeah,
I didn't have someone that I'm exhausted.
yeah,
I don't have
absolutely.
someone who could drive me home.
Yep,
I have to do it. There's no choice.
yeah,
You know, like, yes, I'm taking that on for my choices in a good way, but like,
right.
you have to understand too, like, there's no other option
Yeah,
essentially.
I felt that. Yeah,
I mean, it happens for every single parent too, you know, not just saying just
yeah,
women, but
it's true. It's bad.
oh, like airplane seats are made out of mint.
Oh
Oh,
yeah,
yeah. That's why it never hits right.
yeah,
I'm trying to think of what other things are car safety. That's a big one too recently.
yeah, for sure, for sure. I totally agree on that one because
Yeah.
I feel like some cars are like, what the fuck with
Well,
these
like
shoes?
seatbelt safety,
Yeah.
like their test dummies that they do is always modeled after a man.
Yes, not a female.
We ride in cars too, man.
Like primarily we're in the car with all them damn kids.
I know.
Just saying.
Trying to think of what other office temperatures. That's women are always freezing in
Oh my
office
God,
because they're
yes.
set for like a 65-year-old man.
Oh.
Yeah.
I mean, I like it cold in the offices though, personally, because I told you I can't stand heat.
Yeah, no, I would die in a hot office, but sometimes it's so damn cold and it's
Yeah.
like don't touch the thermometer
And
and
you're
it's
like,
like sorry, let me go get my sweater. Cardigan. But yeah, I leave my house really cold.
yeah, same. Obviously, we're freezing
Yeah.
down here in my basement.
I know, but it's a nice refresher. We would
Like,
different podcast if we were hot.
This is nice.
Welcome to the bitch show. We hate it here. It's hot.
Women in sports bras. Dead.
Yeah.
I feel like unfortunately we're going into the age of where things need to change, but it's just going to take so much time
Yeah.
for men related products and things and services to change to be customized to women.
Yeah. Well, there's some study about like, the old marketing tool for like selling stuff that was originally marketed for men and they wanted to sell like say a razor to women.
Yeah.
I think the saying was pink it and shrink it. Make it
makes
pink and make it
sense.
small.
Make it sense.
Yeah.
Yeah.
It's like, okay, but again, it should be a
Which
totally
is funny
different
because I
product.
still use men razors.
They're so much better.
They're so much better and they're 5 blades and they're real smooth. Like, I
and
want
they last
those.
longer.
Yeah.
Yeah.
Want those. Nobody wants the pink ones that fucking disposable in like a week.
No.
You're like, this
It's your
sucks.
fucking razor burn like no
Hell
other.
yeah.
Hell yeah.
You're like, I'm sorry. It's not working. If anything, I need more blades.
Yeah.
Thanks. I need 8 blades.
8 blades.
8 blades with that shit super smooth.
Have you ever done the single blade one?
No.
That one works really well.
Yeah.
Accidentally, like I brought it on the airplane and like, excuse me, ma'am, you can't have this. I
You
was like,
can't have
oh,
Oh, my bad.
sorry. Damn it. Just pay for that.
Yeah, I haven't tried one of those. I'm okay worried because like I have such bad like razor burn
Yeah,
just from
same.
like shaving in general. Like it's a once a week thing,
Yeah.
unfortunately. Like I have to exfoliate and do like
Girl
shea
shower.
butter and like and put
Yeah.
menthol and the whole thing so that I don't get folliculitis.
Is menthol not burn?
It's I use it. It's like that. It's like shea butter, like menthol, like cream, like so it kind of like cools your skin
Oh,
before
okay.
you're like shaving.
Oh,
And
before. Okay.
before. So I feel like that kind of helps like keep the inflammation like to
Yeah.
stop when I have folliculitis. If I get it so bad. Honestly, I would love to invest in laser hair removal
Yeah.
full time. Whenever I get the money to do that, I will
Yeah.
be doing it, so I don't have to constantly shave as often because I get like 5 o'clock shadow after I've shaved at 8
I
a.m.
know.
You
So
know,
like I goosebumps. Damn it.
yeah, like, but yeah, it's just it's frustrating. So I'm like, but yeah, I'm so weary. I hate to honestly, I hate to shave more than anything. But I'm
Yeah.
like, I was like, dude,
Do you?
yeah,
You're married. You gotta let it grow, girl.
girl, me and my husband should not match.
That was like my swimming days. We would have like you couldn't shave from a certain period.
Yeah.
And like thank God we dated other swimmers because like
Yeah.
my legs would be as hairy as
Yeah.
men's and like we couldn't shave it because like shave for competition is supposed to make you glide across the water or whatever.
Oh, gotcha.
But yeah, like can you imagine just like dating a
Go
non-swimmer and be
what's
like
up?
I can't shave.
What's
I haven't
up?
shaved for like 3 months and I even got to go another like
Yeah.
3 months.
And I'm like, I get it. Like, and I totally get it when people have like light leg hair. Like,
Yeah.
I totally get it.
No,
Like,
I don't.
if I could, I would.
Yeah. I hate when
Doesn't-
people are like, oh my God, I forgot to shave. I'm like,
Where?
Where? Shave this morning.
I got 5 o'clock. I got 5 o'clock man stubble. Okay,
Yeah.
that's not.
Yeah.
It's not cute. It's not
Nope.
cute. Like, and I remember like one girl like in like middle school. She's one of my friends, really really tall, had very long like volleyball legs too.
Yeah.
She's like 6 foot, almost 6 foot something,
Yeah.
and both her parents were like super tall. But she was blonde hair, so like all her leg
Yeah.
hair was like blonde. So like she would only shave her like lower leg and not like her thighs. But
Mhm.
like you couldn't hardly tell she had like because I'm like it's blonde.
Yeah.
You can't tell. I'm German genes. I've got dark hair on my legs, unfortunately.
Eastern European.
Yeah,
That's why
exactly.
I
Like,
got dark hair in my hair. Yeah.
Like example A, example B. Like I'm fake blonding it right now. Like somebody help me.
Just dye my leg hair.
Literally. And some people do that. Some people do that, like bleach, kind of like the people how they like bleach their like buttholes and all that kind of stuff. I'm like, no.
Wouldn't that make it glow more though? Like if you were to bleach your leg hair?
Probably.
You have to have pretty long leg hair to bleach it. Like
to
it seems
bleach
like
it.
a lot of process. to
Yeah.
Just
Nope.
shave.
Just
Unless you're a dude looking for that look.
like I get it, but
I don't know if I get that one.
I
don't know if I get that one.
Yeah. All right, guys. Well, we're gonna wrap it up for this evening. If you have any comments or likes, please send it over to us. I don't know what we're gonna do for our next episode.
Par for the course.
part for the ride.
Yep.
Let's just come along with us. We're talking shit as we go along. So just remember to like us on YouTube, Spotify, and Instagram, TikTok, and we shall see you guys later. Okay, bye.
Bye.